I was raised in Arkansas. I don't come from a medical family, and I went to college in Washington University and then decided to go pursue an MD PhD because I was also very interested in science. So I trained at Johns Hopkins. I did my MD PhD in pediatrics, and there I met John Freeman. And John and I are extremely close, and I think that's when I realized that the ketogenic diet was a very effective therapy. I then went to Harvard to train in neurology and realized their people didn't really utilize the ketogenic diet as widely. And I've stayed at Harvard since, and now at the Mass General Hospital where I've been for 9 years, developing an epilepsy program there, and a large focus of what we do, both clinically and research-wise, is on dietary therapy of epilepsy. And it's also been exciting for me not only to watch Serge's experience in Poland, but even to see in the Boston area the growth in the popularity and utilization of the diet. So we have used we've used the ketogenic diet now for many years, and kind of seeing the difficulty some children had with the restrictiveness and thinking about how the ketogenic diet may work led us to develop a treatment we call low glycemic index treatment. One of the ways we think the ketogenic diet works is by stabilizing blood glucose levels, which then indirectly stabilizes insulin levels, etc. And we figured that if we could find a way to assimilate that in a less restrictive manner, it may be as effective. So the low glycemic index treatment was designed to also try and help stabilize blood glucose levels. And what a low glycemic index food is a food that does not cause such a dramatic elevation in your blood glucose after you eat it. So if children go on or adults go on foods that are low glycemic with limited carbohydrates, it approximates what the ketogenic diet does.
So would you agree that this could be actually, in fact, beneficial to anyone to eat?
Absolutely, absolutely. No, we have now started over 150 people on this diet, and seeing the effects of not only on the children's seizures but also their overall health has actually led me to change the way I feed my family. So my family is almost now, in a sense, low glycemic.
That's very interesting. Do you travel? Do you give lectures about that around
many
the world?
places? No, so there's a lot of interest in low glycemic index treatment for epilepsy. Interestingly, there is a big move now in the world of cancer. That metabolism may play a big role. So I've actually also given a couple talks recently on oncology meetings about our experience with dietary therapy, both ketogenic and low glycemic index treatment.
So for cancer, for epilepsy, how about diabetes?
Well, low glycemic index is a treatment for diabetes because diabetics need to more stabilize their blood glucose. So it's been used in that arena for quite a long time. But I think it will be very exciting to see in the next 5 to 10 years what happens with dietary therapy, because I think it's going to be good for cancer, for all types of neurologic disorders, and many other things.
Wonderful. And you developed that treatment, is that right?
We developed it, so Heidi Pfeiffer and I have worked together for over 10 years, and really it was also just by learning from our patients, because it was really a couple of adolescents we had on the ketogenic diet who had a lot of difficulty with the restrictiveness, and when they came off the diet, they noticed that their seizure frequency correlated with what they ate, and it was really based on their observations that made us think, gee, what could this be telling us, and led us to develop the diet.
So we are what we eat?
Absolutely.
And then what we metabolize, right?
Absolutely.
Yes.
I would like to think it would be. I mean, we often think, why isn't the ketogenic diet more mainstream therapy in the United States and these other diets? And I honestly think Western medicine is very comfortable with things that are in pill form. And I think one of the things the diet is viewed as a diet, so very alternative, even though the ketogenic diet's been used in its form for 80 years, and dietary therapy for epilepsy has been discussed for hundreds of years, since Hippocrates. So I would like to think with time people would be willing to realize, and I think in addition to the epilepsy field, the oncology field is going to drive the acceptance that we are what we eat, and what we eat can affect our overall health and longevity. I mean, I would like to think that people become more aware of these diets as incredible therapies for lots of different disorders, especially epilepsy.
I really thank you so much for your time and for doing what you're doing. Thank you so much.
You're welcome.